This case was filed by the estate of Andrea Tellez Rojas by her personal representative, Yadira Tellez Rojas. We call her the plaintiff. The case was filed against the Hillsboro Pediatric Clinic, who we call the defendant.
It really took a long time to put myself together. I had to go back to work the following Monday after the trial, and I had a lot of anger. I had a lot of just, kind of analyzing about what happened. And, I totally understand why we lost. The defense was able to, quote unquote, put evidence that, made it so that their client didn't appear to be negligent. And like I said, it was just resources. Like the reality is, clinics and or healthcare organizations have more fundings for a lawsuit, but I don't regret anything, and I wouldn't change the attorneys and staff that represented me and my family. I owe them more than I could ever express. They believed in my sister's case, and it wasn't until we were able to get the audit trail and, go through this process that we were really able to see what happened. And to me, as painful as this is, I have no regrets about going through trial, because what I did afterwards is I connected with employees that have or still work at Hillsboro Pediatrics and Tuality, which is Hillsboro Medical Center. And I reached out to other people in healthcare to really kind of put together this project, because healthcare needs to change. I truly believe that it's no longer safe. And it's in this model where it's corporate, like I said, look at all the strikes that are happening. And it's at a point where a lot of the decisions are based on what insurance says, what CEOs say. And I think that if we keep going in this model, this just allows all these errors and safety concerns. And I would never wish what happened to my sister and my family on anybody. So I am going to go ahead and put a video. I interviewed my parents' neighbors who witnessed what happened to my sister after she came home from the lab and the pharmacy and the clinic. And let me just tell you, even they are traumatized. It was not a sudden change. I will repeat, it was not a sudden change that the defense kept on saying. They kept on saying it, and it was not a sudden change. My sister did not have a sudden change. She was unstable, and she got failed through a lot of the things that I've been speaking out, safety concerns in healthcare, way before my sister. And this, to me, just makes me want to just keep on pushing to take care of our patients and take care of ourselves, get better training. So I'm going to go ahead and put a video of what the interview is. And let me just tell you, the defense knew that my neighbors witnessed this, and they didn't, of course they're not going to want them as witnesses. They wanted to put on this whole picture that all of a sudden Andrea just dropped dead, which is not the case. These are my neighbors, or they were my family's neighbors at the time that Andrea was at home. And so this is Denise and this is Asia. If you guys can just kind of tell me what you guys remember. I don't think we've talked since that day. Mm-hmm. So I first want to say I'm really sorry. This is going to explain why my family kind of just had to step away from the world. I'm going to explain to you guys why what happened, what you guys experienced happened. So if you guys just wouldn't mind telling me what you guys remember, what you guys saw, and then I'll tell you basically everything that happened before and afterwards.
On that day, the dogs were barking, and I looked outside and I saw your mom pulling a chair over, and the car door was open, and she was pulling a chair over and sitting down next to the car. And I remember Aisha was in the back, and I was like, Aisha, something's wrong with the neighbors. Something's going on. And she's like, what do you mean? I'm like, I don't know, but like Martha's sitting in a chair next to the car, and the car's open, and there's somebody in the car, and I can't tell who's in the car. Like, we need to make sure they're okay. And Aisha's like, okay, well, you're coming with me. And so we like literally just went out our front door across the street, and your sister was in the car, and she obviously was not feeling well, obviously was not doing well. Your mom kept trying to get her to go into the house. She was saying no, she didn't want to go in the house.
Nose and dressing, she didn't want to go in the house.
She didn't want to go in the house. She didn't want to be alone. She kept saying that she, like Miguel came over at one point, and it all gets kind of muddled. So Miguel came over at one point, and was talking, and we're like, you know, we were talking about, you know, she probably needs to go to the hospital, and she was saying that she didn't want to go without her sisters, and she wanted to know when everybody was going to be home, and she wanted everyone to go to the hospital with her. And
she was waiting for you. She was waiting for you to get off work.
Me.
Mm-hmm.
And stuff, and we were like, Aisha was doing what, you know, Aisha will speak to what she was doing, but Aisha was trying to help, and you know, she was talking about she didn't want to eat anything, she didn't want to drink anything. We convinced her to drink some Gatorade. We got Gatorade. She said she was nauseous.
Do you remember? Oh, sorry. Do you remember how her consciousness was? Like, did she look alert, or did she look?
Oh, I'll speak to that.
Yes, thank you.
So I am a nurse. I've been a nurse for 7 years. When she had passed, or when I saw her for the first time, I had barely been a nurse for a year and a half, but I'd been exposed to a lot. I worked at a skilled nursing facility, and I took care of a lot of different patients. And so I was hesitant to go over there because I didn't really know. I hadn't been an acute care nurse at that point. I didn't really know, you know.
Mm-hmm.
And so I went over there. The car door was open. It was hot outside. I was like, can we please take you inside? And she was like, I don't want to be alone. I don't want to be alone. And then I just remember her being like, she was yellow. Her eyes were yellow. Her face was yellow all the way down. And then I was like, let me see her feet.
Mm-hmm.
And her feet were just this shiny, bright yellow. I can't even to this day, I can't get it out of my head.
She looked jaundiced.
She very jaundiced. And that's what I was trying to explain to your sisters. And I was like, when your sister gets home, have her come talk to me, because I know nurse to nurse, it's different.
Mm-hmm.
It's just, we know the communication, we
Yeah.
know the lingo, we know how to express importance, concern, escalate things in each other's brains to get the care that we need for our patients, because that's what we do. That's what we're good at. So I was like, my mom was like, do you have Zofran? And I was like, I do. I have Zofran left over from when I was pregnant. So I went home, got Zofran.
She was
Yeah,
she was nauseous. She wouldn't drink anything because she was nauseous.
But then she was like dry heaving almost, and it was hot. It was hot, and she was in that car. She wouldn't get out. So all the doors were open, everything was open. She was like laying down in the passenger seat, I think.
She was in the passenger seat.
And we had it pulled all the way back, and I went home, got her Zofran. My mom went and got Gatorade. We like basically were trying to do everything we could, and then finally, if I remember correctly, you guys finally got her inside, and that's when we would
she never went inside.
She
never
went
inside.
inside. Had already been to urgent care, I think.
Mm-hmm.
She'd been to clinic,
And they said it was a virus, and it was because it was during COVID.
Mm-hmm.
So everybody was scared of everything, and so everybody was blaming COVID instead of.
But she had
addressing
negative for
it.
COVID.
Mm-hmm.
I think she had a whole. Because I was
asking
asking what
virus, and we're like, that doesn't sound right.
I was like, it doesn't make sense with her jaundice, with her so jaundice. Like I was like, I'm thinking like full on liver failure at this point.
Yeah.
Like that's how she looked. And then I was like, can we please just get her to the ER? And she was like, I don't want to go.
Yeah.
I want my sister.
Yeah.
Where's my sister?
Yeah.
And then I don't know what happened. I don't know if everybody left or something. But then we ended up eventually somebody came over and told us that, you know, she had passed and invited us to her service and everything. I think I got a text message from Miguel. Yeah, I think Miguel texted me.
You told me like early
and
the next
told
morning.
me
That she
because
died.
that she had passed, and that they had taken her to the ER.
No,
The events.
your mom was trying to convince her to go to the hospital. Like everybody
At
was
some
trying to
point,
convince
she
her.
was okay.
No,
So-
I think after I came over and
She kind of calmed down a little bit.
Well, I think I provide them the reassurance that like I was there to help.
Yeah.
But also, like, I think somewhat I ended up getting her. I finally got your sister to understand, like, no, we need to go.
We need
like,
to go.
We need to go. Like, I know you don't want to go, and I know you've gone, and I know that they failed you when you did go. But I need you to go take her somewhere that she's going to get care because she needs it. Like, it's not like, oh, urgent care. It's like, this is immediate right now. Like, she needs to be.
Yeah.
So you guys are worried already that something emergency is happening, correct?
Yeah.
Like,
And I don't know. Well, because that
She
girl
was
was
not well.
pale. That girl was pale as could be in general.
so
But let me tell you, she was. I've never seen
you
somebody
guys
so
were-
jaundiced.
so I want to.
I've never seen somebody so jaundiced.
So I
And
want to tell you guys now what happened because all these things.
Her feet look like Oompa Loompas. I mean, I don't mean to.
Their
be that-
attorneys
but,
knew
like,
this,
that's
by the way.
That's
They
the
knew.
only thing
we
that I
told
could
this.
compare it to. I don't want to make it sound like it was
Yeah.
a joke or anything.
Yeah.
But like the only other time I've seen that yellow orange color is on Oompa Loompas on TV.
And I'm going to tell you guys why what happened kind of happened. So, first of all, before I tell you, thank you guys for being there. It definitely sounded like there was an emergency, and so I'm going to tell you before what happened, why you guys saw that, and why maybe she didn't want to go to the ER. Maybe why my mom didn't press harder, because it angers me what happened in the clinic and in the lab. And then I'm going to explain to you guys afterwards when I get there. And then I'm going to explain to you basically what we went through, like trial and everything that I experienced with why someone gets away with how they get away with things. But so before that day, my sister had got, I hadn't lived with them. And so I pretty much know what you guys know, like once I actually get there. But my sister had been sick for about a week and a half with flu-like symptoms, but she was also vomiting, headache, dizziness, a bunch, other things. And she went through 3 different providers within that week and a half span. The first time was at the Hillsboro Pediatrics clinic. She sees her name's Kelsey Jo Moss. She had graduated as a nurse practitioner, I think in December, still finishing up her doctorate or something. And she, from what I found online, she started working there in January. So this is August. She's still a new nurse practitioner. No blood pressure gets taken. And I'm already questioning the vitals. I'll tell you why later, but the notes. Then she kind of gets sick later. At this time, Brenda is taking her. She's not going to work right now. So she takes her to the first appointment at the Hillsboro Pediatrics. Flash forward the weekend, she goes to Randall's urgent care, and for vomiting, headache, dizziness, no blood pressure again. No blood pressure. She's 13. She's 13.
How do you not?
Exactly.
Isn't that like I've never walked into a doctor's office where the first thing they do is strap a thing to my arm and make it so tight I feel like my hand is numb.
Vomiting, headache, dizziness, hemodynamics, but they don't take blood pressure. She's stable for home care. They basically say follow up with your primary care provider. So this is Randall's urgent care, children's urgent care.
But that's all heart.
Yes, no. So, but it'll lead up to. I will tell you. I know you have all these questions. I had them when I
Sorry.
first.
I'm like, wait,
Yeah. No, I'll tell you in a sec because I
not
had.
virus, heart.
So yes. So then, the last day that she was alive, my mom, because Brenda went back to work, she takes her to Hillsboro Pediatrics around 2 p.m. Because my sister's not getting better. She's actually felt worse, I think. And they see the same provider, the new nurse practitioner that they saw a week and a half before. I think a week and a half. They also don't get a blood pressure for the symptoms: headache, vomiting, flu-like, fever. I think like intermittent 103. She's vomiting, and in the note she says dizziness upon standing, headache keeps her up. So
You think orthosthetics?
you think orthosthetics? Thank you. So, and then this is like after everything happens, and I'm asking my parents.
So orthostatics, you go and you take their blood pressure 3 times. You take it with them laying down, you take it with them sitting, and you take it with them standing. And what you're looking for is a drop in blood pressure, because if they're dizzy, then most likely their blood pressure is dropping, which makes them a fall risk, which then makes them, if you're falling, you're breaking things, right? And mind you, she's 13, it's fine. I mean, she'll probably be fine, but that's what they're looking for. That's what they should look for.
But she's
That's what everybody
13
looks for.
and she's hemodynamics
Exactly.
already,
It's not
vomiting,
making sense.
headache.
Yeah, it's not making sense.
It's not making sense, right?
She should be able to overcome any virus, any sickness, because she's so young and healthy in general.
So this is I just want to lead you up to it and then I'll explain. This is I
Yeah.
found this out after everything's said and done. I asked questions and it's but so my mom took Andrea to that last visit. My mom doesn't speak a lot of English communication wise. They didn't get an interpreter for her. Even though her chart, and I have it here, that it says that my sister needs an interpreter right here. And so they don't get an interpreter for my mom. So my mom, basically, it's the Andrea and the nurse practitioner. And my mom did tell me, like, the nurse practitioner speaks some Spanish. But come on, the mom of a 13-year-old needs to know a care plan. So what happens is my mom told me that she's worried about my sister at that appointment. And my mom goes, hang on, what else can we do? Like, she's worried. She's telling me, she says, like, ¿qué más podemos hacer? And that's where the nurse practitioner sends her to the lab, Tuality. So a minute or 2 driving. I have personal concerns that they were just going to discharge her, but that's a different later story. So my mom expressed that she was not okay. So she asked the nurse practitioner, what more can we do? They sent her to lab. And at Tuality, because my mom is still nervous, she doesn't speak Spanish, and my sister is vomiting. My sister left the Hillsboro Pediatrics vomiting, and they gave her an emesis bag. So again, why no blood pressure at this point? I don't know. My mom comes and picks up Jasmine because my mom's worried that she doesn't know where the lab is and my sister's already sick, so she can't do it alone. She picks up Jasmine, who's at home from OSU at the time. And so they take Jasmine, they go to the lab, and at this point it's like almost 4:00. It's after the visit. They come real quick to pick Jasmine up and they go back to Tuality.
Which is like 5-minute round trip.
5-minute round trip, not far at all.
No.
And here's where they failed her again. So my sister at this point, she's vomiting. Jasmine and my mom take her up to the lab, which is across the street from the ER. It's within a vision distance. So here to my house, from your house to my house, it's right there.
Yeah, we're very familiar with Tuality.
So what happens there is also me off. I also had a meeting with Tuality after this. So my mom knows that Andrea is the last patient of the day. The lab tech, who's also training someone, told her that she's the last person. At that time, my sister's already having like shortness of breath and she's like anxious. That's how they described it. But she's pretty much getting worse. And my sister's kind of just asking like when is everything going to be done? And then so she's kind of like just short of breath. She starts vomiting again, and at this point, my mom tells Jasmine like to tell the lab that something's wrong and that she doesn't look good and that they need a wheelchair. Because at this point, my mom's worried that my sister is getting weak. So Jasmine asks the lab texts the person she's training and the other person, hey, where's the wheelchair? My sister doesn't look good. Like, we need a wheelchair. The lab tech says something along the lines like, you can go get the wheelchair. It's downstairs, blah, blah, blah. So that alone right there, I'm already pissed hearing this in the aftermath. So that lab tech failed to recognize that my sister can't walk, that they need a wheelchair. But instead of them asking like further questions, they send Jasmine to get the lab. Like, what a big dismissal. Like, that right there angers me just thinking about it, because my sister left without she never walked again, leaving Tuality. Like, she left in the wheelchair, and then at that point, my mom, the nurse practitioner from Hillsboro Pediatrics, said they were going to put in Zofran, and we go to the same pharmacy. Like, since I was a patient there, we haven't changed it, and my mom goes to the pharmacy after the lab. And at that point, they send Jasmine because my sister does not want to get in the car, like out of the car. She can't walk. And at the pharmacy, there's no prescription, you know. And in my experience, oftentimes is the provider hasn't put it in. They're like backed up, they're busy, they went to the next patient. So there's no Zofran. They were going to give her Zofran for that vomiting, but they didn't. So they come here, and that's what you guys saw. So right there, my mom didn't get a care plan from the clinic. They didn't give her an AVS. They didn't give her an interpreter. Then they goes to lab where she's thinking it's in the hospital. It's right there. You can see it within the ER, like the ER. So, and she gets dismissed. So that's 2 back-to-back locations where my mom she's not given that education or that respect to be like, so then when she comes here, like I had a feeling that Andrea has the same thing, right? She's like, I already went to the doctors, I went to a hospital, and they said, you're fine, I'm fine. Like at this point, like I can only imagine what a 13-year-old and what my mom, who didn't have anything explained, going through their heads are probably like, we're just thinking things and we're fine. Like, and that to me angers me so much.
Your mom was definitely concerned.
Oh yeah.
Like she was definitely concerned. She definitely knew something wasn't right. And
I
I know we kept saying, go to St. V's.
Yeah.
Don't go back to Tuality. Go to St. V's.
Yeah.
Take her to St. V's.
But she, like, it angers me to know that they didn't explain that to her. And I'm thinking, and I'll tell you why I am theorizing that the nutrition that they didn't, they were going to dismiss her without even doing labs. But, so my mom is feeling something's wrong, but she's kind of in a place where she wasn't given an after visit summary or anything. And, later the nurse practitioner will testify that she did tell them. My mom basically told me, like in the aftermath, once I moved in with them, she's like, I would take her to the ER if they told me at any point that they were concerned. Like,
I've never seen somebody's feet so yellow. I've never seen somebody's feet so swollen. I've never seen somebody look like this before. We need to get her somewhere, and I don't care where we go. I don't care if I have to go with you. I don't care if I have to carry you there, but you're going to go because I don't know. I can't not save you.
Yeah. No. So I want to thank you guys because I just want you to know that that was a big failure that they didn't do to my mom or to my sister, because
it was like we did more interventions for her than anybody else.
I think you guys did an amazing job, and I will never. I just want to thank you guys.
It's basic. It's basic, but like, I mean, if I could fix her for 10 seconds, I could fix her for 10 seconds.
Yeah. Yeah.
And as nurses, we're supposed to save her.
And I think you did. I just want to tell you that because I think you guys gave her a little bit of respect, and she kind of almost got a little, kind of, she compensated a little bit because, you know, they're kids. But then Brenda, and I have the audio of her trial, but basically what happens is she comes home after work, and it sounds like she was a little better from what my mom said. She was like, but my sister has no idea at this point what's happening. She has no idea of the negligence that she already went through. Like, cause my first thought when I'm get like a missed call and they're like, just come home later, I'm thinking she went to a provider. I work in healthcare. They would have done all of the things that I'm used to seeing with doing. They would have given, you know, if they had any concern that they
provided you false reassurance.
Correct. But they would have escalated already. So it never crossed in my mind that there was any like wrongdoing yet at that point, because I don't know. And so it sounds like when Brenda got home, she just sat in the car with her, and Andrea and Brenda didn't know anything either. And so at this point, Brenda and Andrea, they're kind of like calling people through Zoom, and this is their attorneys know this, by the way, because I'm going to tell you that they did not want this part in the jury hearing this. So it sounds like Brenda kind of felt like Andrea was short of breath and that she was like unstable. But again, she, like, her mindset was my mindset. She just went to the doctor. She just went to the hospital. Like, and that's because my mom said we went to the hospital, right, labs. And so then at some point I was going to come home after work. I did stop by Fred Meyer because my first thought was, I haven't seen them. Let me go buy Andrea a little teddy bear while I'm there. Let me just get some, like groceries. And I heard that Andrea was sick, so I like bought her popsicles and just stuff that I thought,
stuff that would make her
feel better. And my dad had also called me saying, like, because he didn't know this, like, you know, what's happening with Andrea. I said, can we go get some, because he worked at the time as a truck driver, and he was like, let's go get some boots. So at this point, I get home, I pick my dad up. Like, I don't stop and be like, hey, what's happening? I said, I'll be right back. And all I see is undressing. But why? And I said, Andrea, my dad asked me to go get boots with him. I'll be right back. I'm not even questioning, like, because, you know, I heard nurse, what I just said. She went to go see somebody. And so when we come back, that's when everything happened. I don't know if you guys saw, but I'll kind of tell you the fast version because I have to disassociate to go through this. Once I finally get here, Andrea is just like, I get this horrible feeling in my stomach, like, what's going on? And she's there, like, just looking sick. She's talking to me, but immediately I want to go ask my mom what's going on. And at that time, she's in the kitchen, and she gets a call from the nurse practitioner with labs. And this time, she gets an interpreter. And I asked my mom if I can talk to her, and she said yes. So then at that point, I just remember talking to someone, female, and basically saying that the labs are normal. Immediately, like, I hear Brenda outside saying she's looking worse. And I'm already having this, like, gut feeling like I want to throw up. So I tell the lady in the phone call saying, you know what, we're going to take her to the hospital. Like, it looks like she's looking worse. So when we're driving, at this point, like, I hop in the back seat because Andrea never got out of the car. She never, and instead, Brenda's already sitting with her in the driver's seat. We get to the end of the street here, and her heart stops. We do CPR. We call 911. We get her back. At this point, we're like, still in shock, but we're taking her to Tuality because that's the closest. Like you said, it's like freaking 3 minutes. Like, like it's
if you've got full lights and board, it's like 1.5.
It's right 0.5. So I told the EMS, I'm like, by the time you get here, I'm already there. So we get to the hospital. At this point, I'm like telling Brenda, I'm like, tell me what happened so I can give a quick report. And I go in, like, at that time, they had people that are non-staff outside the doors, like, just kind of screening. And I'm just basically, like, saying, she doesn't have COVID. I'm trying to tell her she needs a medical attention right now because she collapsed, coded. We brought her back. And at that point, Brenda is helping her get into a wheelchair. And the lady's just kind of frazzled because I'm like, we need someone. So then we finally get in. I have the same BS. I have to report and tell her I need someone now. And then they put us in a room, and I'm sure it was faster, but it seemed like a lifetime. At that point in Tuality, my sister basically codes again. And at that point, I come out yelling like a maniac, saying, we need, and I think I swore, like, we need someone right now. We finally get the response team. Andrea's still alive at this point, but she is just not mentally there. As we're taking her back to the back,
the back room.
That's where she takes her last breath, and she codes for an hour and a half. And I'm watching it all, waiting for my mom. And mind you, I have no idea what's going on. I just know that Andrea is, like, I'm well aware of what the situation is, that she's coding and they're doing CPR. So then my mom gets there, my dad, everybody's getting there, and I know.
You have to explain to everybody what's going on.
Then I already know it's been like half an hour longer, and I'm sitting out in the hallway just watching it happen.
You just know she's not coming back.
And I hear one of the nurses say, I can't get her heart back. And I look at each other, and I'm like, at that point, I'm just like, still in shock, kind of like that disassociating. And so all of that happens. It's so, like, traumatic. Like, I'm praying, like, please, like, don't take her. Please, like, take me or take, And then that's where, like, she's gone. And that's where we came back around, like, 1 a.m., like, kind of like just what happened. And a few months go by because, we can't talk about it. Like, we're shut down at this point. It takes a long time for my mom to want to talk about it. So then when I'm able to talk to about it, this is probably like October. All of this starts coming out. Like, I'm like, they didn't give you an interpreter. They didn't give you an after visit summary. Like, these red flags in my mind are just, because I already had them, but I couldn't talk about it yet. So then what happens is I get her to sign an ROI so that I could look at the records. And that's where I kind of want to show you guys. I'm going to expose some things about Hillsboro Pediatrics. I talked to employees, plural, and once I told them what happened to my sister, they were more than willing to tell me all of their concerns and what they remember from that date. So many of these employees have been working there for multiple years. Some of them don't work there anymore, but they said that at least now there is not an EKG there. One of them thinks that at some point they might have had an EKG there, but they never got training in it. So at some point they got rid of that machine. So I'm really interested to see how somebody with a 5-star rating does not have an EKG. I really hope you get an EKG at some point, Hillsboro Pediatrics. As far as changes, now guess what you do have to do at Hillsboro Pediatrics? Now you do have to get full set of vitals for all visits, including a blood pressure. So that is definitely needed. The patient that Dr. Gutierrez diagnosed with myocarditis, I have no doubt in my mind that they got a blood pressure, and that led her to send him to the ER and consult with a cardiologist. The defense kept talking about, we can't talk about hindsight. And a lot of things got updated both at Tuality and at Hillsboro Pediatrics after this lawsuit. So change has happened. I'm sure they don't want another lawsuit. And so they are improving care for patients by making these changes. As far as, the Spanish interpreter, they have to document that. And again, the House bill passed, not even just Medicaid patients, but it sounds like that in a clinic setting, on patients or medical settings, you do have to get an interpreter and document. So both Tuality and Hillsboro Pediatrics and employees told me that that's what they have to do. They have to document that they did that. Cindy Farmstrong. Cindy Farmstrong, the nurse practitioner that was a faculty at the same time and around the same time that Kelsey Jo Moss was not just this nursing student, but also working there at the same time. She testified that she worked at Hillsboro Pediatrics around 2017 for about 2 months and then changed. The odd thing is that nobody remembers her. So I quote, this is what one of them had to say. One of them said, "I don't remember her." One of them, when I showed them the picture of Cindy Farmstrong, she said she never worked there. She said she didn't work there. She did not work there. I was there. I can tell you 100% she did not work there. Those are direct quotes from employees. So it's really interesting that multiple employees don't remember you, Cindy Farmstrong, yet you testified that you worked there for 2 months. And again, these employees have worked there for many years at some point. So remember when defense kept saying that Kelsey Jo Moss, her day to be out of the clinic was on Thursday, and that's where she would normally document? What some employees told me is that she did work on Thursdays, at least in 2020, August 13th of 2020. She was scheduled to work there. And it sounded like as soon as she found out that my sister passed away, that she got sick and she had to go home. And Dr. Gutierrez basically told staff that Kelsey was devastated that Andrea passed away. So they sent her home. And they had to close her her schedule, and that the remaining patients on her schedule were distributed between other providers. So defense, I wonder what the likelihood is of them knowing this, because they kept saying it was her day off and that's when she normally documents. And even Kelsey Jo Moss testified that Thursdays were her day off, and because that was the case, that's why she gave instructions to my mom about the lab. So, math ain't mathing on that one either. So I also do want to point out that staff knew that Kelsey Jo Moss was not fluent in Spanish. It sounded like some of the medical assistants were teaching her Spanish. As far as interpreters, it looked like it would depend on the complexity of the visits. So for what she deemed complex, she would get an interpreter for office visits. For sick visits, it sounded like she did not get interpreters. And, one of the employees told me that patients would leave the room not understanding what happened in that visit with lack of interpreters, and they would send them back to the room and basically tell the provider that they needed to explain the care to them. So it's not the patient's job to ask them, the provider who is getting paid to provide care, that they need to understand the care plan. That is the provider, that is the clinic's duty to make sure they do. They also said that Kelsey Jo Moss was worried about my sister, that she was concerned at that visit of August 12th, and that's why she consulted. Now, some of them had opinions about the nurse practitioner that they consulted with, but I'm not going to get into that, what they thought of that person. But it sounded like they would recommend somebody else to be consulted. As far as, templates and healthcare and documenting, a patient's chart is a legal document, and it is supposed to be objective, and you document what happened, and you shouldn't document if you didn't ask questions. Now, there are instances where even I've witnessed people documenting things that didn't happen. So one of them did say that would look at a provider's chart and see that something was documented, and then she was like, I don't remember that question being asked or that being done at the clinic visit when it's documented that it was. So take that as you will. I mean, anybody in healthcare can tell you that the way, because you're expected to see so many patients, it is template based. You're supposed to document what you did and take away what you didn't. But is that the case? I mean, depending on what type of person you are. So, Sarah Ewan. Let's talk about Sarah Ewan because, here are some direct quotes about what some of her coworkers described her as. Sarah had to be reoriented and retrained because she did not want to work at the beginning of the pandemic. Sarah Ewan, lazy and inexperienced. Sarah Ewan cut corners. She worked at nights because she was going to school. And they said that Sarah Ewan was often not with a provider, so she wouldn't be rooming, that she would be doing procedures or tasks instead of rooming with a patient. And so that's how they described her. And mind you, that was before I told them what happened. I started out with, tell me about this person and what was your experience with her. So, the demeanor that I thought of her based on what happened and in the courtroom, pretty consistent with what her coworkers who have worked with her thought. As far as updating charts, medical assistants, some of them said that you were able to update vitals. So one of them said that if there was during the day, they would write it in a sticky note, the vitals, and then at the end of their shift, they would go back and update what the vitals were. So when I asked them if that's something that they're able to change, they said that they recall that they were able to do that they could essentially update the vitals at the end of the shift after the patient left. A common theme was lack of training or poor training at Hillsboro Pediatrics. They said that there was a lot of a lot of people were new, and that there was no structure. Some of these employees have worked in a different facility before or after working at Hillsboro Pediatrics, and some of them said that it was the blind leading the blind as far as the medical assistants, what they knew, that's how they would train the new person. One of them basically said that, working at a different organization now, that they realized that they were taking blood pressure incorrectly. And somebody else said that they didn't feel like they could speak up, and that there was not 2% check for medication, so the wrong vaccines would be given. There were no meetings with staff, and I think I said it already, but they felt like they couldn't speak up. And then it's pretty inconsistent what defense and employees were saying, and then as far as there's one I'm forgetting, so let me take a look here. Oh, so during the pandemic, it sounded that Hillsboro Pediatrics was using high school students as volunteers who were screening and taking temperatures of the patients. I did talk to somebody that was a nurse practitioner student at OHSU around the same time that Kelsey Jo Moss was, and they remember her. But when I would tell this story to people, because I wanted to get some information, I would start out with obviously like telling the person, here's the scenario, what vitals would you get, and blood pressure would be a thing that they would say, so it's not based on hindsight. Anybody that has dizziness or headache or vomiting, we want to get hemodynamics. So when I told them about what happened, they found it strange, because the first thing that they said was that at the OHSU program that you have to take a PAIRS or a PALS course. And, those train you to identify instabilities, cardiovascular specifically as well. There's other stabilities, but they were really, really shocked that a blood pressure wasn't taken, because he said that's what we got trained on. And even on their website, look, the PNP 7441, you're required to take PAIRS or PALS certification. You also have to do a prerequisite. It looks like there's multiple that I found, that the program said that you do have to take PAIRS or PALS. So, and that's also American Heart Association, something that Dr. Yuklaw, the cardiologist, that he works with. So it's very, very credible organization, the American Heart Association, American Heart Journal. But anyways, so looks like here Kelsey Jo Moss on her professor profile, on her LinkedIn, it says that she's also PALS certified, or her skills. And let me just tell you, with Kelsey Jo Moss, because I would keep looking at her stuff, at some point there was nothing in her LinkedIn, and then at some point there was. Looks like there's some information again on her. She must have, it's been a year, so I'm sure she makes sense why all of a sudden her information's back on there. But looking back at the Dornbecker Children's Hospital, because they also offer PALS certification, and it looks like on some of their goals to know at the end of the certification, it says recognize the infant or child at risk for cardiopulmonary arrest. It says the course will focus on identifying pre-states and preventing cardiopulmonary arrest in children. And guess what? The PAIRS and PALS, most of the assessments did have blood pressure. It talked about identifying, and it talked about compensation. It talked about, a lot of things. And so thank you to the nurse practitioner that, told me about that, because, it's really true. Like that, I wonder why the defense didn't want any articles that talked about standard of care or any type of sightings, but it's just really, really, just, it was my first, it was, again, these are people who do this for a living, and they've represented many, 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 medical malpractice cases, with a lot of resources. So it's just the things that you learn, with why or how things happen. So pals and pairs. I'll put a lot of things that I found about there, and because blood pressure is needed. There shouldn't be a reason why you don't get a blood pressure on a child who has hemodynamically unstable symptoms, or at some point, a headache. My sister was definitely dehydrated, and and I'm not going to talk in a soft voice about it. Now, I hope you guys know. Now it makes sense why, in the third person, they would think, why don't they take Andrea to the hospital if, she looks like she's dying. My mom was never given the education, the after visit summary, the interpreter to be able to, comprehend that something's not right. Kelsey Jo Moss did not do service to her or Andrea or anybody, to tell my mom that something was wrong. And my mom and Andrea went to the hospital. I'll say it. It's in a hospital. They went to outpatient lab, which is right across the street from the ER. And then there, they were dismissed. I've worked with people before who cut corners, and, this was their last patient, and it sounds like they were training someone, and there was their opportunity to notice that something was wrong when my sister Jasmine had said, hey, there's something wrong. We need a wheelchair. Instead of calling the medical emergency, they just sent her home. They said to Jasmine, you could go get the wheelchair. Like, imagine how frustrated I am. And I want people to know this. The trial, I felt helpless because I'm just sitting there and listening to these experts who, quote on, wear a lot of hats in the community, and they're saying things that, just putting a picture that Andrea was going to die anyway, and that a blood pressure was not needed, and that something so rare. So we're going to go ahead and start with Mark Buckles. And so this is going to be that patient with the MISC, and he did a few interviews about vague symptoms, because the defense kept saying my sister's condition was so rare, her symptoms was vague. But I'll say it again, I'm not upset that Kelsey Jo Moss failed to diagnose myocarditis. I am furious that she didn't do an adequate assessment that would lead her, that there was something, some type of instability that would prompt her to send my sister to the ER, or at the very, very least, communicate that with my parents, my mom, and just, that is such a big thing. We need to educate our patients about a care plan, give them an after visit summary. So I'll go ahead and put this first video up.
19. What we know now is that it can affect otherwise healthy children who have recovered from the COVID virus that may not have had any symptoms from it.
We talked to Dr. Mark Buckles at Randall's Children's Hospital at Legacy Emmanuel. He's currently treating Oregon's first child diagnosed with the disease. Buckles tells me the 14-year-old middle school girl from Washington County went to the doctor last Saturday after nearly a week of unexplained symptoms.
She came in with about 5 days of fever, abdominal pain, harder to walk, shortness of breath. Then her eyes became really red.
Her doctor called the hospital and she was admitted the same day, but Dr. Buckles says she was already in cardiac failure.
Her blood pressure was critically low.
The teenager is still in the hospital recovering, being treated with what Buckles calls unique medications.
Immune medications, cardiac medications, as well as blood thinners.
We asked him about the symptoms parents should look out for and when it's time to take your child to the doctor.
Call their primary care doctors or bring the child in if they have unexplained high fevers, abdominal pain, rashes, red eyes that are not explained by something else.
Leah, a healthy soccer player, became sick and has been in the hospital since Saturday.
It was terrible. My stomach was hurting a lot.
She first came down with a fever, abdominal pain, and red eyes, all symptoms her pediatrician spotted as signs of that rare mystery illness. Leah had cardiac failure and was in shock, but was treated for severe inflammation doctors suspect was triggered by an earlier infection with COVID-19.
I'm very grateful because I could have been gone.
Doctors say this is still a rare condition despite the uptick in cases in the last 2 weeks. Best thing parents can do is be on the lookout for those symptoms because they can turn so serious in just a matter of hours.
There was nothing normal about it. Leah developed a fever and shortness of breath. Then her eyes turned red. She went to her primary care doctor, who sent her to Randall Children's Hospital by ambulance. And when she arrived,
Her ultrasound of her heart showed significantly decreased function.
Dr. Mark Buchholz, Leah's lead doctor, says she was in cardiac shock. She was given meds, and within 24 hours,
The blood pressure improved. The heart function is still decreased, and she still needs medications, but she feels remarkably better.
From the bottom of my heart, I am thankful that that child is safe. They mentioned a ultrasound of the heart. I wonder if that was right after the x-ray, right? And if you notice on one of the videos, they showed a blood pressure because, of course, heart failure, even on children, you need blood pressure. And, I doubt that the pediatrician was automatically looking for heart failure, but they more likely did an adequate assessment, including blood pressure, which helped lead them to cardiac symptoms. So you miss a key vital, probably miss the trajectory that needed the patient to go to the ER. So I want to talk about rare for a second, just because the defense really kept saying, oh, this rare thing, yet some of their defense witnesses said that, they had training about myocarditis and blah, blah, blah. So you get training in school about something rare, huh? Jeff Young, in his opening statement, because he, quote unquote, is a double duck at University of Oregon, when he was describing rare, he put an image of the stadium at that school. And I think he said, I don't know how many stadiums he was going to put, but he just basically was trying to tell the jury, this is how rare this condition is. Mark Buchholz did an interview and where he talks about, that he was a father, and then he's going to talk about how even if it were 1 in a million, that he one out of 1 in a million is too many to die. So I truly agree with that. It doesn't matter how rare a condition is. If you don't do an adequate assessment and you miss it, that doesn't excuse the fact that it was missed. So let's see what he had to say. This is only part of the interview.
MISC. Could you tell us a little bit about that complication, what MISC is and what it does to kids?
The complication is multisystem inflammatory syndrome of childhood. MISC affects children, and it usually presents with prolonged fevers, rash, vomiting, diarrhea, and other systemic complaints, and it can affect the heart, causing severe inflammation.
It's kind of rare to see MISC in vaccinated kids. Is that true?
It is.
Is not really covered well in the press is that children die of COVID, even though they die at a lower rate. Talk to me a little bit about that.
They do. We'll read in the press that the hospitalization and the death rate of children is much less than adults. It's likely due to children have less overall issues with their body. They're not as sick as an adult. However, as a parent, even if it's 1 out of a million, if that one is yours, it's one too many.
Yeah, it is one too many.
So as a parent, huh? If that kid was yours, 1 in a million is too many. I completely agree. I want to focus on that part because, again, Melissa Bushnick, Aaron Potter, and Jeffrey Young are all parents. I have no doubt in my mind, like my mom said, that if they were in a position where this happened to their child, that they would be doing exactly what we did, and probably worse since they know the law. At my mother's deposition, because Aaron and Jeff were just talking about their kids, my mom can pick up in a few words. And when they were talking about their kids, I said it in a previous video, at the end of her deposition, she told them this with an interpreter. She said, if you guys are parents and you would be doing exactly the same thing. I think about that even now to this day, because seeing the shame in their eyes when my mom said that, like, I just want to picture it again. So they sat next together, and when she said that and the interpreter actually translated what my mom said, they looked so ashamed. Like, they couldn't look at her, they couldn't talk at her. They were like that was the most human that I've seen out of them. And I think about that because that's what pushes me to get this story out. And it's not okay what happened to my sister. You can't just say, oh, something's rare, she would have died anyway, and blood pressure's not needed, blah, blah, blah. Like, that just drove me to do this project, especially when I felt down. The last part about Mark Buckholes that I want to, he talked about one of his hats, like Melissa Bushnick described in the community. It sounded like he was familiar with the PANDA program. And again, they put this narration that, oh my gosh, all these side effects, this was going to take such a long process. Yes, anything has side effects, even Tylenol. But when it's warranted, like epinephrine. And so this is just part of one of the PANDA videos from OHSU that, it's opposite of what they made it sound like. Oh, it's going to take forever and you need all of this staff, blah, blah, blah. Yes, that is true. But these are trained people that once an emergency is needed, they are going to act at the top of their scope. And so it looks like these are two nurses, critically trained, and they talk about if anything happened while they're in transportation, that they are ready. And so that's opposite of what defense was trying to narrate. So.
And pick up that child from that hospital and bring them back to Portland.
Gina and I have a lot of experience in the hospital. Every PANDA team member has to have at least 5 years of intensive care unit experience. And then that way we can be part of the training. We have specialty training for trauma and NICU, PICU training. We're all transport, neonatal and pediatric transport certified. At least 80% of the team is.
Yeah, and pediatrics only. We have never even really taken care of adult patients. So we are definitely child specialists.
Yeah.
And also some advanced practice skills that we have just in case. Hopefully we don't need it, but just in case you do, is intubation and chest tube insertion, umbilical lines for babies, so we can really take care of your baby and get them here safely.
We're a traveling intensive care unit.
We're a traveling intensive care. Yep.
Traveling intensive care unit. Thank you for your services, because that is definitely needed.
Load up our isolate. We're not going on a real call right now, but
we would have left way faster.
Way faster than this. But we'll just show you what it's like. Good? Yep. My button. Take our. People always comment about our backpack sizes, and it's just because we carry so much stuff for various size kids. So
all the medication that they might need and anything that might happen.
Anything that might happen. Again, what I'm really upset about is that my sister was not given a fighting chance. There would be no lawsuit if I knew that the clinic, the providers, did quality care. They missed important vitals. They did not provide patient education, no interpreter, and that just speaks in volumes to why what happened to my sister happened. Dr. Yuck Law, he is the Seattle Children's cardiologist who, testified that, he would not send Andrea to the ER because, according to him, my sister wasn't not showing symptoms of heart failure. If she did with her labs, than he would, because her labs were abnormal. And, she was having heart failure symptoms. The documentation, I'm not going to trust at all, especially with what you guys just found out with what my neighbors witnessed. But, some of his titles, the hats that he wears is the medical director, cardiac transplant, heart failure services, professor of pediatrics in the Children's Hospital. So I found it really interesting that, blood pressure was not included in a lot of the myocarditis, at least kind of when you look at the surface, when you find information there. There were other things in Seattle Children's Hospital, the websites, when you would look at other conditions, then they would talk about myocarditis. They would talk about, things to look out for was hypotension or decrease of blood pressure below baseline. So blood pressure is key to diagnosing, or at least leading you to the part where somebody might have myocarditis. But here's what I personally think is very misleading. And, wearing these big hats at Seattle Children's Hospital, I found this to be really interesting because you were, in the heart failure department. I think it's heart failure services, the director. When you look at myocarditis, the website on Seattle Children's Hospital, it's almost like there's an effort not to have blood pressure included, but under heart failure, it talks about blood pressure. These are basically word for word paragraphs with the blood pressure taken out. So when you're looking at the myocarditis website on there, it talks about how to diagnose myocarditis. And it says, to diagnose this condition, your child's doctor will examine your child thoroughly. This includes using a stethoscope to listen to their heart and looking for signs and symptoms of heart failure. No blood pressure. It does talk about other things like chest x-ray, EKG, echocardiogram, MRI, cardiac catheterization. But when you're looking at heart failure, because, if you're looking for myocarditis, you're looking for heart failure as well. Same paragraph, but just the ending is different. So the blood pressure is taken out. How is heart failure diagnosed? To diagnose this condition, your child's doctor will examine them thoroughly. This includes using a stethoscope to listen to their heart and checking their breathing and, drumroll, blood pressure. So that is very interesting, right? It's the same paragraph, but what was taken out of myocarditis is blood pressure, and it was changed with heart failure. But under heart failure, it does have blood pressure. So I just thought that was very interesting. And, I wonder how that was changed and when that was changed. But having the same paragraph and just the word change at the end, take that as you will. Is it misleading, or is it just convenient when you're dealing with a lawsuit that, he testified that some of his patients are refer to him without taking a blood pressure, and yet to diagnose heart failure, you need to assess the blood pressure. Anyways, I just thought that was really important because I'll say it again. When you're sitting in this courtroom, and I kept telling myself, if I did not work as a nurse, if I did not work in peds, if I did not work, I would be believing every single thing that these people with these hats, these big hats, have in the community. It wasn't until I was able to pick myself up after the trial and really find my purpose, which is improve healthcare, that I was able to just reach out to people that, want to improve patient safety, and they were able to kind of help me in putting this project together. So what did I find out about Tuality Hospital? Because, they got dismissed. We never got to trial with them, but I'll say it again. What happened with my sister was negligence. She was unstable to leave. She could not walk leaving that hospital. outpatient or not. A street away, within distance of an ER. And I'll say it again. Doesn't matter what your title is. If you cut corners, if you're lazy, or if, there, in any position, you're gonna, how you are as a person, it's gonna transpire. So, I did reach out to some people from Tuality, and, they did, I remember in my deposition, one of my concern was that just because healthcare as a baseline is short-staffed. So I just remember one of my when I had Aaron Potter was talking to me, I said, they must have been short-staffed because they were training somebody, and he goes, "How do you know that? Were they short-staffed? Because where you work, maybe that's short-staffed, not at Tuality. How do you know? How can you guarantee? And the people that I talked to that did work at that time said that they were short-staffed. They were short-staffed. Even now, I think they're barely starting to fill the positions. There was a point where there was an email sent, and I'll send it. I'll put it up. That the phlebotomist, there wouldn't be a lab person at night, so the nurses would be asked to draw blood, and some of them said that they weren't trained. And as far as interpreter, guess what? So my deposition was at the end of October 27th, I believe, on Friday, 2023. So in December 2023, Tuality sends an email to their staff saying, in 2022, the House bill passed this, and now you're required to use an interpreter. So, and it's really interesting because I wonder that motion of having the interpreter dropped in trial. I mean, I wonder if they were already thinking about that after my deposition. Hey, you need to get an interpreter now. And, one of the motions in trial was you can't talk about hindsight, or you can't, because this is how change is made, right? We're suing, and we're telling them this isn't okay. So now they are looking at things to improve. And so now in Tuality, they do have to document that they are using an interpreter. They're required to use an interpreter because that is the House bill passed. You need an interpreter. And, this happened in 2021, 2022, and what happened to my sister was in 2020. So unfortunately, we couldn't fight that. I still don't, it doesn't make sense to me morally, but, change is happening with things like what happened to my sister. Somebody gets upset and they push this changes. That's what I'm doing. I'm pushing changes. Because I think that that's the only way that somebody's going to listen with these big titles in healthcare. So they have to document, and they have, now they have video, whether or not that's actually happening. Somebody that I know that went to Tuality this year, 2025, they don't speak English, and I asked them, did you get an interpreter? And they said no. So again, is that happening all the time? Depends on the person, right? How long do they want to take with a person, and because it's going to take longer, how much are you pushed to see how many patients? So, the main concern with Tuality is just unsafe environments. It sounds like even new nurses are being asked to take on more patients. The Oregon Nurses Association in inpatient setting for 2026, they did rule there's a law that 4 patients per nurses, but that won't be in effect until 2026. So it sounds like Tuality is still having at least 5 patients per nurse per shift. So Aaron Potter, I remember that one of their things that they're deny about negligence was that they did not have an outpatient medical emergency response in the hospital. And because the lab where my sister was seen, even though it's in the hospital setting right across from the ER, that they were considered outpatient. So in the time that we were suing, the medical emergency policy was only for inpatient setting. So one of the staff told me that there is, at least now, emergency response for outpatient lab, and that, you know, the nurse, you know, once it's paged, they assess, and they said, I feel like they're doing this more now. So again, right, these changes, I'm wondering if it's because we sued and we're calling them out. And when I told them about what happened to my sister, you know, they were shocked. They were shocked because, you know, one of their quotes said they should have called a rapid response and sent her to the ER. That's an employee from Tuality that said that. So all of these things are happening because we are fed up with unsafe environments. And, you know, they talked more about other stuff as well, how apparently there's, you know, new grads that are, they're hired and they quit after about a month or two breaking their contract. So I really hope that Tuality improves their care, because, you know, a lot of the community in Hillsboro, you know, they are Latin or they are minorities. And, you know, same thing with Hillsboro Pediatrics. You know, you need to work and look at what your patients, where your demographics are, because, you know, that really leads to how you're going to provide quality care for them. What drives me to do this, and I know I've said it before, but I'll say it again. This was such a hard thing to do. You know, after my sister died, going through trial, being in depositions with people like Aaron Potter and Jeff Young, and then meeting someone like Melissa Bushnick, you know, people who are skilled at what they do. There were times where I felt like I couldn't do it. I'm not going to lie. There were times where, you know, I wondered if we should just stop, because my family, you know, I thought about my dad, I thought about my sister Jasmine, I thought about my mom, I thought about, you know, we were already suffering this loss of my sister on top of the pain and fear of going through trial and, you know, potentially losing. But as painful as it was, I don't regret any of it. You know, that trauma that I felt, or I encountered. Look at what's happening now. I truly believe that those changes are because of Andrea, and whether or not they're doing it to prevent another lawsuit, if it's one life, multiple lives being saved, believe you me, everything that I faced was well worth it. Like, it is not justice what happened to my sister Andrea. I'm gonna meet her again one day, but she's gonna save lives because of what happened. And to anybody who's ever felt helpless, anybody who's ever, you know, and I say this with respect, whether it's sexual harassment or, you know, domestic violence or any type of injustice in the community, speak out. Speak out. It's not going to be easy, and there's times where you're going to have to remind yourself of why, and, you know, the outcome might not be exactly what you wanted, but there are people in power, people who have influence in the community that are betting on you not coming forward with things, and they know it, and they will try to discredit you. And the only way change is going to happen is if you speak out. The more you speak out, the more you're going to influence other people speaking out, and that is how change will happen. If somebody's not going to change because it's morally correct, exposure will change, will help. Be the person that you needed the most. And I don't know if I was gonna even talk about this. Here's my theory about what happened with Kelsey Jo Moss. This was a new nurse practitioner. at a time in 2020, that's not an excuse, in a place where there's poor training in that facility, and partnered with a medical assistant who was described by her peer, cuts corners, how to be reoriented, and, consulted probably with the wrong nurse practitioner. And, when they saw my sister. And so, it's multifactorial with the negligence that happened. But aftermath of, just trying to make it seem like my sister was suddenly, sudden change, like that doesn't excuse what happened. That doesn't excuse that, after a negligence was done, that you try to deny it. At some point, admit that there was wrongdoing, and we had to sue to expose that. Now, I hope that people in Hillsboro Pediatrics and Tuality and anybody who sees this really looks in the mirror and, we need to do better in healthcare. We need to do better. There's this environment where we're just fast, heedless, everything, and there's just not enough quality. There's not enough staff. There's not enough, all of these things. We need to keep pushing for patient safety, provider safety. So I ask that everybody just really take a look, get involved in your community, get involved in your council, empower yourself, whatever you are upset with, be that change that you need. That's what I'm doing right now. I wish I had somebody that would be there for Andrea. No, she's going to be there for people that need it. And, where I work, there's going to be an upcoming, bargaining, whether or not we're going to strike. And, to anybody that is doing strikes or bargains, for patient safety, please look at this story. Get inspired. Let's make it uncomfortable. Let's expose what's happening in healthcare. Because there's this model, even in insurances, the doctors are having to, it's not what their training is telling them as a treatment is what is insurance going to cover, because it's more expensive. Insurance are denying life-saving treatments, and that's not okay. That is not okay. So to anybody that needs this, empower yourselves. You are not alone. We will make change. If not for us, for somebody that needs us. So that was Andrea's story. The last thing that I want to do is just say thank you from the bottom of my heart. Anybody who's listened to the story and reflected, or if it's helped anybody, this is really what this video is for. But I really want to say a special thank you to the team that represented us. No words. I'll never have any words to express the gratitude that you did for my family and for Andrea. Scott Levin, thank you so much from the moment you heard my story and took on this case. Stephen Voorhees, thank you so much. No words will explain just how thankful I am. Rachel O'Neill, thank you so much from the bottom of my heart. And Liz, Michelle, Jake, to all of our witnesses, our expert witnesses that came and testified, no words will ever express. Mr. Zamora, Dr. Chang, Dr. Hamling, Miss Jones, anybody else that I'm forgetting, I from the bottom of my heart, all of our expert witnesses, thank you so much. And I'm going to keep pushing for patient safety and change. Nothing new came, from losing my sister as far as what I believed needed to be fixed in healthcare. This pain is just going to keep motivating me to help really bring awareness of why we need to keep improving healthcare. To anybody, there are bargainings and strikes and everything, keep pushing, because I believe that there is a change There is going to be a change in healthcare. You know, it's not about profit. It's not about how much money. These are patients' lives and our safety as well for staff. So from the bottom of my heart, thank you so much.